Welcome everyone to the 11th Annual Aging Summit. The summit is brought to you by LAAAC, the Los Angeles Aging Advocacy Coalition. LAAAC strives to bring together consumer advocacy groups, aging service organizations, and other key allies in Los Angeles City and County and beyond to be the united voice for older adults, family caregivers, and organizations serving and or advocating on behalf of older adults. My name is Rigo Saborio, and I'm the chair of the LAAAC and president and CEO of St. Barnabas Senior Services, and I'm delighted to have this opportunity to kick things off. As many of you may know, the Los Angeles Aging Advocacy Coalition was founded a little over a decade ago by Ultimate Health Services Corporation, Partners in Care Foundation, and St. Barnabas Senior Services. Since then, its membership has grown to over 60 organizations and countless numbers of advocates, representing well over 1.5 million older adults in the LA region. We realize that true impact, the power to effectuate major change, is realized when individual organizations and senior advocates unite on behalf of the greater good to launch something larger than themselves, a movement to be reckoned with that transforms the aging landscape in Los Angeles County and beyond. Through the dedication and resources from the founding organizations, support from the SCAN Foundation and other member organizations, and the work of the St. Barnabas Senior Center staff over the years, the coalition has played a critical role in shaping local policy decisions and has been a strong partner at the state level as well. And after COVID prevented us from getting together last year at our planned annual summit, I am so thrilled to be able to say that we are back. But until we can all come back together safely, we shall move forward virtually. And that said, the summit this year will take place over a series of 4 sessions every Thursday in October, focusing on the master plan for aging's 5 bold goals, which are housing for all stages and ages, health reimagined, caregiving that works, affording aging, and inclusion and equity, which will be woven into each of the 4 sessions that we are going to hold, because it is an incredibly important and an issue and an area that transcends everything that we do. And we must always lean with equity. As many of you know, the master plan for aging was unveiled in January 2021 by Governor Newsom, which includes goals and initiatives that state and local governments will and are now undertaking to make California, America's most populous state, more age and disability friendly for all, and to prepare for the unexpected growth of California's 60+ population to 10.8 million by 2030. The plan resulted from a collaborative effort involving a range of stakeholders and state agencies led effectively by CDA's director, Kim McCoy-Wade, who, by the way, has been appointed as California's Senior Advisor on Aging, Disability, and Alzheimer's for the Office of Governor Newsom. So we all obviously stand together and congratulate her and wish her the best in her new role. She leaves a legacy, and we're really excited to have the MPA in place. So for today, though, as we are kicking off the series, we're going to be focusing on caregiving that works. And this, of course, as you all know, has to do with individuals who do the daily and hands-on work of caring for older adults. And we believe that these individuals should have the support they need to perform this essential service without sacrificing their own physical, emotional health, or financial health. And so to kick us off this morning, I am extremely delighted on behalf of LAAAC to have with us Assemblymember Wendy Carrillo, who represents the 51st District, to share her thoughts about how to best support caregivers in Los Angeles and throughout. So I am delighted. I know that she's extremely busy, but I'm just pleased that she could make time for us this morning and to share her thoughts with all of us regarding caregiving that works. Assemblymember Carrillo, welcome.
Thank you so much. And again, my apologies that I'm doing this from the car, which is a lot of moving parts happening this morning, but I'm so honored and grateful to join you today My name is Wendy Carrillo. I represent the Assembly District 51, which includes the communities of Northeast LA and East Los Angeles. I've been on Health Committee for the past 4 years that I have been in office, and I'm so grateful to be able to do this work. In fact, my grandmother, may she rest in peace, worked for Altamed for many years in the PACE program, and she dedicated her life to helping others. She was a nurse in our home country of El Salvador, and when she came to the US, she couldn't practice, and so she went into caregiving. My mother is a caregiver with IHSS. My aunt is a caregiver within the IHSS program. And so knowing and how we value and care for our most vulnerable in our communities, whether they are people with disabilities or our elderly community, it is something that is very near and dear to my heart. And that's why we fight and we champion issues that ultimately, at the end of the day, are about improving quality care for our most vulnerable families. And so again, thank you for the opportunity to speak with you all today about some of the wins that we have had this past year with an unprecedented budget moving forward amid a global pandemic. There's been a lot of opportunity, but I do want to share that my district has been one of the most impacted across the state. The most essential and frontline workers, Latino families that have been impacted the most by the pandemic, whether it's not having access to, very early on, if you remember 19 months ago, access to testing centers, the ability to be able to do remote work. A lot of my community has been on the front lines as essential workers, having to go to work, not having the opportunity to quarantine safely at home. Children who did not have access to broadband devices or a laptop or an iPad to be able to learn and to be able to participate remotely. That all impacts our community, and specifically the Latino community across the state of California. More than 60,000 people have passed, the majority of whom are Latinos, right here at home in our state and really across the nation. Farm workers who had to work amid a global pandemic and California wildfires, most of whom are immigrant Latinos or indigenous people who ensured that because of their sacrifices, not only California, but the nation was able to eat and have food in grocery stores. So I bring that all to say that that has been at the forefront of where I do my work and where many members of the legislature come from to ensure that our communities receive resources that we so desperately need and deserve and have a right to. This year, for the first time ever after several years, we are fortunate that through the budget process, we were able to ensure that all Californians, regardless of immigration status, all seniors over the age of 50 have access to Medi-Cal, which means that our undocumented abuelitos, abuelitas, our grandparents have access to Medi-Cal, which has been a fight for many, many years. And California is the first state to do so. I've been in office for 4 years, and in the past 3 years, I have been championing the elimination of the medical assets test, which only continues the cycle of poverty for our communities and for our elderly population, because the medical assets test would say that you couldn't own a home, you couldn't own a car, you couldn't have savings in your bank account, because then you would not be able to qualify for Medi-Cal, and your health coverage could be in jeopardy. And that only means that seniors had to eliminate their savings, that had to get rid of any assets that they had so they could have the bare minimum and continue to live in poverty so they had access to healthcare. That's wrong. And it's, as the 5th largest economy in the world, it's impossible to think that that was the reality for so many people. And so we were able to change that through the budget process. We were able to give access to undocumented people, undocumented seniors over the age of 50, access to Medi-Cal. Another bill that I'd like to share with you related to skilled nursing facilities is we changed the law to ensure that whenever a skilled nursing home was changing ownership, that the residents and the families of the people in those skilled nursing homes had the opportunity to know what was going on, so that they wouldn't be surprised that all of a sudden there was new changes in management, new ownership, new staff, especially when you depend on others to care for somebody that you love. So those are just a few things that we have been working on that I'm proud to share with you all as we continue to move forward in ensuring that quality care is at the forefront of the conversation in healthcare, and really ensuring that all communities across the state of California and the 40 million people that call this state home have access to resources. Just one more thing to add for all of you, we all pay tax dollars into our California state budget. And I would say that the budget is a reflection of our values to ensure that the dollars in the California budget are reflective of our values, and that we put forth budget conversations that at the end of the day help ensure that the safety net works for everyone. And family caregiving is a huge priority in ensuring that our population has those resources. So again, count on me for whatever it is that you need to move that forward. And again, thank you so much for the opportunity.
Thank you so much, Assemblymember Wendy Carrillo. We really appreciate your, your personal, sharing your personal story with your family, and the connections, obviously, that you've experienced firsthand and within the older adult spectrum and family caregiving as well. And then also to hear your role and working with colleagues in Sacramento to create effective change and championing those changes, particularly to, when you think about immigrant communities and most vulnerable communities, older adult communities, we thank you. We thank you for being a champion for these causes. And what better way to kick us off today to really, share, some positive movements that we are seeing. We are so excited to have champions like you now on behalf of family caregivers and older adults and the disability community. I mean, we've waited for a long time, and starting with the governor and signing off on the executive order to launch the master plan for aging to prepare California over the next 10 years, and working very closely with leadership through different departments and agencies. It's been exciting. For someone personally who's been in this field for 30 years now, once upon a time, I was the youngest person in the room, no longer, but for 30 years we've been doing this. It's an exciting time, and and I guess good things come to those who wait, and we thank you. And we look forward to continuing our work with you, Assembly Member. And so thank you for today. I'd like to thank, just quickly thank the LAAAC leadership and the organizations they represent for planning this event. So in terms of AARP, CARA, Justice and Aging, WLCAC, Partners in Care Foundation, the Alzheimer's Association Los Angeles, Alzheimer's Los Angeles, St. Barnabas Senior Services, and Wise and Healthy Aging. Thank them all for their contribution in making today a reality. And so now I'd like to introduce to you our session moderator for the panel session, Molly Davis. Molly is the Executive Vice President at Wise and Healthy Aging. And so really pleased to turn this over to her now, who's going to lead the conversation on caregiving. Molly?
Thank you, Rigo. Thank you for your opening remarks and welcoming us all. And thank you to Assemblymember Carrillo for joining us this morning, and for all of her work in supporting those that we all care so much about. So this is an interesting format for us. We are the maiden session of the LA Aging and Advocacy Coalition's program in October. So we're excited about that. And we have a fabulous panel that I'm going to do quick introductions on, and it's really going to be a conversation. So we have some questions that we prepared to help us kind of have a dialogue about caregiving that works. And we hope that for anyone who has questions in the audience, you can put those in the chat. We will have some dedicated time at the end of the session for questions, but I know sometimes as they pop up, you want to get them out before you forget, forget your questions. So, so without further ado, I'm going to introduce our panel. We have Elvira Castillo. She's a gerontologist who has served in a variety of senior roles in city, county, and state government, and also in the nonprofit sector for the last 35 years. Most of her experience is involved in oversight and implementation of Older Americans Act programs, which you'll be hearing a lot about today. She continues her commitment to advocacy as a policy advisor with AARP and also as a board director of St. Barnabas Senior Services here in Los Angeles. Welcome, Elvira.
Thank you.
And then we have Vivian Mbaku. She's an attorney who works at Justice and Aging, specializing in elder justice policy work. She also contributes to the National Center on Law and Elder Rights, which provides training and support to legal services attorneys serving older adults throughout the country. Welcome, Vivian. And then we have Dr. Donna Benton. She is a research associate professor of gerontology at USC Leonard Davis School of Gerontology and the director of the USC Family Caregiver Support Center and the Los Angeles Caregiver Resource Center. She, along with Rigo, were on the committee that developed the master plan on aging. So we're really excited to have you here on our panel.
Thank
so welcome.
you. Thank you.
Okay, so we're just going to kind of launch in. So I'm gonna kick this question to Donna to start us off. From your perspective, what do you think we need in Los Angeles to fully support caregivers?
In thinking about this, and thank you for inviting me and being part of this panel, I want to give my apologies early on that I may not be here the full time for questions. I have to jump off, but to answer your question, in Los Angeles, we're looking at what are some of the gaps that we can see to help our family caregivers. And I would say that we have to continue to look at what kind of workplace policies that we can do at a local level in Los Angeles that would help family caregivers self-identify that they are part of this larger caregiving community so that they can have easier access to resources. Some of the time, many times caregivers are utilizing a healthcare system and they are, maybe they might be having stress-related disorders and no one has ever asked them, are you caring for someone at home? Are you helping your mom, your dad, something like that? And so if we can find a way to integrate questions to begin to help identify caregivers, that would be a really big step in LA if we could have that better. The other thing, of course, is coordination of our caregiver services within LA. The USC Family Caregiver Support Center serves all of LA County, but I still think we're the best kept secret for family caregiver services. And then we have WISE and we have adult daycares, of which we do not have enough. So I think we should be supporting that too. We could also look at how we can advocate for having professionals who are in Los Angeles learn more about caregiver issues and possibly having more incentives to have people understand and work with family caregivers and help with social work and gerontologist and pharmacy, all becoming more aware of the prominence of family caregivers because 1 out of every 4 households has a family caregiver. So I'll stop there because I know other people have ideas too.
Thank you, Donna. And it sounds like, so when you're talking about having other professionals who intersect with the different aging issues, it made me think about even beyond that, having professionals at different corporations who are caregivers have that part of their EAP program or, that sort of thing. So that just sort of sparked that thought. Elvira.
Yeah, just to add a little bit to what Dr. Benton already had talked about. And I'm speaking from experience as a remote caregiver. My mother, who was in a facility assisted facility, boarding care facility in Northern California. During her time there, it was positive. And one of the things that made that good, not only for the family, but for her, was the fact that they spoke Spanish. My mother was an immigrant to this country. She did become a citizen, and she remembers 3 presidents, Eisenhower, Kennedy, and Clinton. And she was very proud of that. But the fact that they spoke Spanish. And the other thing was we were able to visit her really anytime. And that was open. It was a small facility, licensed for 6. I rarely saw more than 5 people. So that again, personalized it more for her. The language, the personal attention. And that was very, very, very critical in terms of her being safe, being clean. And my visit to her was a nice visit. I didn't have to run around, and her medication, her bathing, because for caregivers, that is a major challenge and a major burden. The other part I think that we need more of is training. Workforce development, as is addressed in the master plan, I think it's key. But we need to realize that caregiving, and Dr. Ben-Ray talked about some statistics, is going to be a major challenge. I've heard people say crisis in the area of healthcare for our population. So appropriate training and training for health professionals, health aides, but also some kind of training for their other areas that are involved in the whole spectrum of caregiving. Again, from a personal experience. Hospice, they should know a little bit more about caregiving, not just the end of life, that's important, but the family as they go through that. And the other thing that, again, a personal experience that my sister dealt with was public guardian and conservatorship. Again, our involvement, the family involvement in caregiving and what that means. She had to answer a question once about, is your mother thriving in that facility? A child thrives in daycare. My mother had Alzheimer's, incontinent, needed help with all the daily activities of life. So I think we need that kind of education too, to those agencies, those industries, those services that somehow connect with the family when they're going through this caregiving for their loved ones.
I think you hit on a really important point, is that the caregiving doesn't stop when a loved one moves into a facility, right? The caregiving changes, right? It changes to teaching the facility the things that, the things that only the family knows, right, about their loved one, and being part of that process and being recognized as continuing to be a caregiver. And sometimes it shifts to advocacy, right? To try and get better care for your loved one, or understand what it is, living in this new environment means, right? For daily life and for life for the family. So thank you for your comments on that. And we are going to talk a little bit more about legal services a little later in the session. So we'll talk about a little bit about conservatorships and those sorts of things briefly. Any other thoughts about what do we need in LA? So the master plan on aging is a really big document, and then we want to boil it down to LA. Donna.
So I was thinking the other thing which helps for 2 parts of the master plan, which is housing. And for family caregivers, we know that many times the caregiver brings the older adult into their homes, which can require a lot of home modifications, and maybe, or needing a, what we used to call like a little granny shack in the back. And I know that California has changed some of the laws for that, but Los Angeles needs to really, I think that we could help with some of that reimbursement for families when they make these home modifications, and having help build up services locally to help with these specialized modifications. We know, I mean, people think it's really easy to put a grab bar in, but if it's not put in properly, it's more of a danger to the person. And so for family caregivers, they need these very specialized modifications for their homes, for whoever they're caring for. And of course, we still continue to need respite. There's a great model in San Francisco that they have a pot of where some of the tax dollars went that are specialized just to go for respite for LA County members. And we cannot, we get a lot of money. I mean, I consider, you know, a fair good amount of money in respite, and we still can't meet the demand for respite because it's not a substitute for everyday care. But if you can imagine, if we could just allow for a day a week so that a caregiver can take a breath, so that they can relax and sleep and go to a movie. I mean, sometimes it's just, let me just go to the restroom without interruption. But imagine a day a week or twice a month. It's not asking a lot. They're not saying, I'm never doing caregiving again. But it, you know, there is a cost associated with maybe 400 hours of respite. And I think LA could develop a special fund just to help caregivers with respite that's not necessarily tied to income, because many of the caregivers themselves are not, you know, it's not that you're looking for them to qualify for public services. They usually are working. So they're not going to qualify for public services. And so we need to have programs that understand the working caregiver.
Thank you for that.
I also wanted to, I agree with everything that Elvira and Donna have said, kind of jumping off Elvira's personal experience with her mother and having caregivers who spoke the language of her mother. I think that it's a really important point to highlight, with the increasing diversity of our overall population, but also the increasing diversity of the older adult population, which was highlighted in the master plan. It's really important that caregivers, these private caregivers really do reflect the communities that they're serving and the people that they're serving, and recognizing that having that kind of diversity, having someone who understands you, your culture, speaks your language is really important to building that trust and having a really good and positive caregiving experience. Like Elvira mentioned, she felt better that her mother was surrounded by people who spoke her mother's language, and that really improves the quality of the care that people have. So I really think that representation really matters, and making sure that people understand like what kind of job opportunities are available, and are we really making sure that the communities that we're serving are really reflected by the people who are working there. And then also workforce supports as well, super important. I did want to highlight that within the May revise in the budget, there was some money put aside, 200 million for IHSS long-term care pathways program, which is a new program. And then also an IHSS specialized upskilling pilot. So both of these programs were created to provide opportunities to caregivers to get education and skills. So for them to move forward to become certified health home aides, nursing assistants, and other related careers. And then also these pilots were created to help these IHSS workers gain additional competencies in behavioral health, working with people who have Alzheimer's, dementia, other cognitive disabilities. The programs are not up and running as of yet. I believe DSS has to do some work to create them, but I think it's important that everyone is supporting programs like this, understanding that people have space to learn, they want to learn, and these programs actually pay the IHSS workers to complete these trainings. So it's really giving people an incentive, giving them money to support them in doing this. And then in the end, that trickles down to better outcomes for the people that they're actually caring for.
Thank you for that, Vivian. So we wanted to talk a little bit next about we talked about what we don't have in LA and what we'd like to see in LA, but we want to talk a little bit about what we do have, so that anyone in this session who isn't familiar with the web of services that are available has some information about that. So I'm gonna, oh, Elvira, yeah.
Well, one of the things that just pops into my mind that I'm familiar with is the long-term care ombudsman program. And the other one that it's really also very close to my heart is the adult protective services. And here in LA County, it covers the city and the county areas. And I think that is one program that has expanded. People are more comfortable reporting. Plus, I think the staff, while not increasing in numbers, have become really in tune to what is happening out in the community through the work of what you're doing now, through the work of different committees, conferences. So I think that's very important to highlight them. It's not a cure-all. There is still a lot of abuse or potential abuse for a room for intervention, but I think it's a good step and a good platform to continue to build on that. And again, create a way of educating that caregivers have that as a resource, create that knowledge, create that outreach to those populations.
Okay, great, thank you.
I
We'll
def-
be-
oh.
yeah, go ahead.
I definitely agree with Elvira. APS and the Long-Term Care Ombudsman are two really great resources that are available in our community. Also, I would highlight legal services as well. I'll talk a little bit later about that and more of what's available. I think it's just really important to highlight that caregivers serve such an interesting role in that they are often, the first to see an issue or a problem. So it's so important that not only caregivers know about what's available in the community, but also these organizations in the community reach out and are able to connect with caregivers because they can see, where the connection is and be able to help people. And I would like to highlight specifically about APS. This past legislative session, a bill passed that is expanding APS eligibility. So before you needed to be 65 and older, and now it's 60 as of January 1st, 2022. So that really opens up the amount of people who are able to receive services from APS and is really going to be great. And a lot of that was actually pushed because of the understanding of the growing number of older adults who are homeless and experiencing homelessness, and understanding that they are aging faster and they would need more support. So that's something for people to know, that there is an expansion for APS services. So make sure you know who your local APS provider is, and how to get in contact with them.
I would say that there's several things that we can that can help caregivers along their journey. Of course, the first one is the LA Caregiver Resource Center that covers city and county, and that is a comprehensive place where you can start with. You have education programs, respite, legal services, counseling, one-on-one case management. So and it's for all income levels. And so I think that that's really important. And it is caregiver specific. The client is the family caregiver. And so many times people, but they generally don't self-identify. I think the other thing that's helpful is, of course, we have several diagnostic centers for dementia, and that caregivers, sometimes they're not sure what's going on in addition. So we have specialty clinics like at the USC clinic or the UCLA diagnostic services for Alzheimer's. Of course, we have the associations like Parkinson's Association, Alzheimer's and Stroke Association, which are really important for understanding specific traumatic brain injury for all the different, for different dementias. And it's important for families to reach out to all these resources. And every resource has a different reason for using it. So it's not that you can only go to one and not to the other. I think that sometimes people think, oh, well, I can only enroll in this program and not that. Use them all. So from our center, we have things that are online. So it's important that you can go in and look for educational materials and find out what other resources are out there. So of course, we always have as I always say, Google is my friend, and YouTube channels for very practical information. I know we're going to talk about legal later, so I think that's really important for the conservatorship and understanding, kind of what rights you have. The work family, there's the work family programs that help you understand workers' rights, which are very important for caregivers who are working. More than half of caregivers are in the workforce, but they may not know about paid family leave or paid sick time. Within LA County and in various programs, we've had some maybe additional sick time beyond what's being just recently passed by the state, which is the 3 days. I think now there's some places like in Long Beach, I think, where it's 5 days, but we need to be aware within the city how we can expand sick time for family caregivers. We also can continue to look at the definition of who can take time off to care for someone. It's very restrictive, but I think within LA, we can expand the definition of who is a caregiver and who can take time off for care. So that's kind of, and then of course we have the whole mental health services, because we're looking at family caregivers, and one of the things is there's the stress and there's anxiety and just general cope with some of that stress that might be helpful through the network of mental health services, which you can get through your insurance program, their public clinics, or their support groups. And again, you can reach back out to the USC Family Caregiver Support Center, LA Caregiver Resource Center, and they can help link you up with supports, because you hear so often that caregivers feel like it was just me. And for IHSS workers, the majority now are both working as an IHSS worker, but also they are family caregivers. So what that really translates to is they may get paid for 6 hours, 4 hours of the day, but they're not just walking away from their family member. They're going to be there the other 20 hours to care for that family member. And they can still use all of the services that I just mentioned that are separate and apart from the paid part that they have, because they're relative qualified for IHSS. So
Great, thank you.
that's what we have. There are a lot of gaps, but
Yeah.
What we need is that coordination.
Yeah, right.
And there are efforts, exactly, as Donna was saying. There's no wrong door move. There's no wrong door policy that a provider, a consumer, a caregiver, one door, and maybe there is the whole menu of services. That there is an effort that way. And in some places, I think they are succeeding. Baby steps, but they are succeeding.
211 is a perfect example. They are really building their caregiving profile, and they now ask regularly if any caller that comes in is asked if they are a caregiver, and they screen for caregivers. And it's been part of a pilot program with AARP. And what's interesting is we're finding like people are calling about housing. They're calling about meal services. One person we just recently listened to was just calling to find out where to get a driver's license. Turned out they were a family caregiver. And so when you begin to ask the question in the right way, you can begin to identify, because again, family caregivers are not going to self-identify. So we need to be proactive. That's why we're here as advocates, in helping to help describe what is caregiving. Are you you call it, I'm just going over to help my aunt mow the lawn. We call it caregiving.
Yeah, that's a really great point. You're right. Caregivers don't always self-identify. And so when they call in for something, they may think they need one thing, and then you talk to them for a bit and you realize that actually they could use a whole host of supports. So that's a great starting point. And we do have lots of support groups. Alzheimer's Los Angeles has a lot of support groups and great resources on their website as well. They're targeting specifically caregivers and in a multitude of languages. So lots of great resources here in LA. It is, again, finding them, right? And so we're hoping today that part of this conversation is to help highlight some of those things that may be those hidden gems that we don't want to remain hidden. So maybe we can move on. And one of the things that I've heard a little bit from folks this morning is a little bit about inequity. And one of the things we wanted to talk about was, what are the inequities that exist for caregivers, and start talking a little bit about that. And then we also want to talk about what are some solutions to bridge those inequities. So who would like to
start?
Althea?
Well, one of the things, and it was already really articulated by Assemblywoman Carrillo, it has to do with technologies. I know that is one of the initiatives in the master plan. I personally have used telemedicine 50-50. And it's good. It's good that we're moving forward, using those technologies, being more effective and efficient, and maybe reaching a broader audience. However, as the Assemblywoman articulated so well, we know that during the pandemic, kids in rural areas suffered education. They were not connected to Wi-Fi, have difficulties with even having the right devices. So we know that happens in rural areas. But again, as the Assemblywoman said, also in our community here in LA. Again, poor kids, communities of color, and especially in those households where there's multi-languages. Kids could be very advanced with their phones and not the parents. So I think that's one big inequity, and it's an important initiative in our plan, yes, but I think we have to go and learn from what happened with lack of those technologies in those communities. What is the impact on those kids? And for us, I think, is what would be the impact health-wise, securing services, et cetera, in those that we take care of, in the older adults. And that to me is again, an issue close to my heart, because it is so close, yet, you know, the technology is distant in another galaxy. So again, moving forward, you know, 22nd, 23rd century, fantastic, but we are still a little bit in the 19th in some places.
That is so true. This pandemic has certainly highlighted, I think, something that for aging services organizations that we've always known, but we always worked around, right? You know, because we're trying to create accessibility for our clients. So we'll do things over the phone or in person, in their homes or at our centers, right? But having everything moving to a more digital platform has really highlighted not only that some people don't have the devices that they need, or they don't have the broadband, or even more so, because those things are easier to come by, they don't know how to use the technology, right? And that is an incredibly important, or have the ongoing tech to work out bugs when, you know, all of our things, you know, break down, and many of us have figured out how to tinker with them to make them work again. But, you know, all of those things it's again more for the kids. You could hand them the devices and they knew what to do with them, right? For many of our older adults, we need to show them how to use them, and that's a whole nother area that we need to work on. Any other thoughts about inequities in caregiving?
Yeah, I think that, you know, it's really, we've kind of touched on it, but I think that in terms of caregiving or any kind of support that we're giving to caregivers, any programs that are related to caregiving, it's always really important that we center equity and think about who's actually accessing services. And I think a part of that is really folded into making sure that we're collecting data and being really transparent and reflective about who's accessing programs And why are some people not accessing programs? Oftentimes, we create a program or there's an idea and there's funding behind it, and then you put it out, and then it's only a certain group of people who are accessing it. And I think it's always important that we probe further and figure out what's really going on. Could it be a situation like Elvira mentioned, where, you know, there's the program, but people don't have the technology to access the program? And how do we bridge those gaps so that we actually are representing everyone and making sure that there aren't any groups that are just further marginalized, when we think we're actually helping by creating more funding or creating new pathways. So I think just always making sure that we ground all of our decisions in equity, and then also really just being open to the fact that you can create something with all the best intentions and it's still not reaching who you want to, and you got to go back to the drawing board and figure out, how are we actually going to reach people? People are different. We have to adjust for everyone.
That's a really great point.
I know,
Definitely.
I know that when we look at the data that we have, because we have a lot of data regarding the clients that we serve, one of the things that we've noticed is that the intersection between complex care and income. We know that our caregivers who are lower income, who are working and also have more complex care, need more intensive services and case management. And so the more that we can have programs to address that when we're looking through caregiving services is very important. And when I talk about complex care, that's like having to give insulin, having to deal with more physical therapy. And so they have more physical things that the caregiver has to do. They're usually needing to both balance work and caregiving, or they have to drop out of the workforce altogether, which then creates income issues for the family overall if the caregiver has to leave the workforce. So in our data, our data has begun to reflect that. We saw that during COVID, the groups that we saw went up by almost 12%, the number of caregivers that had to drop out of the workforce. And this was primarily among our ethnic caregivers. So I absolutely agree with you that data is very critical, and we've been using, that data. And I think that could be another thing, is having the ability to generate more data reports to help with this population. And so we're going to be looking at that issue of, like, where are some of our data gaps and what could we provide to the community more to help with the equity issues.
And Donna, when you and I were talking to prepare for this session, you brought up a really interesting issue related to having paid caregivers through in-home supportive services if you make like $1 over the income level, right? So it's still people who really need access to this service. Can you just talk a little bit about that?
Yeah, I mean, we know that for IHSS, it's based on the person with the disease's income. But if they aren't able to qualify for in-home support services, we find that, they have to spin down, which leaves many families in generational poverty. I think that this is really something that is a definite equity issue, because we know that there are many working people that are working poor, but not at the level of what we call poverty for IHSS. But those working poor are more likely to be Black and Brown communities. So, and then it turns into generational wealth that we aren't able to build within the families. And so the family caregivers are spending more out-of-pocket costs. Studies by AARP and other groups have shown that on average, Black and Brown family caregivers have more out-of-pocket expenses, where the average is somewhere around $7,000. They're more likely to spend more 8 to 10 out-of-pocket for things that just are not always covered by programs. And to help improve, I mean, one of the stories I always remember for one of the caregivers is, they said, my mom had IHSS, and she was able to get the adult depends and adult protection, but the quality was so poor, I had to go and buy better ones because they were going to cause more problems because they were more likely to leak. They didn't absorb well. And so it was actually more of a strain on her, even though the product was free. She had to spend more to get a better quality product that wouldn't cause the skin breakdown and the having to change the bed more frequently. So it's those kind of things that we really do need to look at that hurt out-of-pocket cost, and it is not an equitable situation.
Thank you for that, Donna. Let's move to talking a little bit about access issues that exist for caregivers and also thoughts about solutions. So we talked a little bit about it, right, with the digital divide that we're seeing, right? But let's talk a little bit about some other access issues that you've seen in your work or in your personal life.
Well, I'll just keep talking.
Keep
Since
going,
I have to
Donna.
go, I figured like I'm just going to get everything out here.
That's right. That's
yeah.
why I moved the questions around.
Yeah. So as you said, in addition to what we're seeing for the digital divide, part of what we've seen in terms of access is in particular to finding healthcare providers that are sensitive to cultural differences in caring. Our current policies are very individual focused, and caregiving is a family focus. That's why we call it family caregiving. And so I think that many of the barriers that we see for families when they go into a healthcare provider, they may want to go into the room and, it's like, oh no, with HIPAA you can't, or we're not going to send information to this family member and without permission. And, the older, whoever the person who needs care may not understand all the permissions, and they may think, oh, well, of course you should be talking to my daughter or my auntie or whatever. And it's not family focused. So I think that one of the things that we need to begin to strongly advocate for is a family focused lens. We have multi-generational families, and that's are very common for us. And also, that's again back to what I had talked about, is chosen family. That is another issue that comes up that we talk about, is we may not have what people call blood relatives, but we have kins. For the LGBT community, they build a family system. And so when I use the word family, I mean the very broad chosen family definition. And I think more of our services need to address that, particularly within our healthcare and social services, need to think of a family focused approach.
Yeah. Thank you, Donna. Yes, Elvira.
We're in the center of movie making. We're in the center of here in Los Angeles of a lot of wealth, media, and all these young entrepreneurs and with exciting projects. I think the media needs to be more proactive in terms of announcing, you might say, those services. Let me give you one example. I just love that spot, those two little boys, Caleb and Aaron, I think, for the Shriner Hospital. They don't look like victims. Obviously, there were some health issues, but they're so engaging. They're so fun. I mean, we need to, again, promote older adults, their need for caregiving, the family, through the media somehow. We have film schools here. We have schools of gerontology here. And so I think we need to make inroads with the media, print, visual. Again, I think the cup overruns in terms of talent and resources. But I point to that commercial because I love it. And we can definitely be creative where we highlight our older adults and the families who take care of them without, well, I'm a victim, poor me. To me, that commercial is a model of not only advocacy, but really what is out there and what we can do. I think there's a lot of potential for something like that.
Yeah, that's a really great point, because we had been talking about, I think Donna had mentioned the Family Caregiver Support Center at USC being the hidden gem, right?
Mhm.
And so access on it, at its core is people knowing about where to find services when they need them, right? And so the use of the media and the local talents that we have here in Los Angeles seems like a natural fit. Yeah, and we're getting some comments in the chat about that's a great point. In how we create and develop our message more than just words, using power and visualization. That's from Joshua Williams. Thank you for that comment. And then we have some other comments from Phyllis Willis about advocacy strategies that are in the budget. So please take a look at don't neglect the comment section, because people have some interesting things to contribute. One of the other things that we wanted to talk about are, what are some of the common legal issues that caregivers may encounter? So not only family caregivers, but also professional caregivers, because they may be the first line of recognizing these issues. And I think Vivian is the natural person to kick this one off.
Yeah, thanks. So in this question, I kind of want to split between caregivers themselves, like what they might experience in terms of legal issues, and then what they might see with people that they are caring for. So Donna already kind of mentioned that caregivers might have issues with, hours and workplace environments. They might have issues with pay, depending on, like a lot of other jobs. But then caregivers are also in a very unique position because they're so intimately involved with the people that they're caring for, that they might also recognize potential legal issues that those clients have. So they are in a position to not just receive legal services for themselves, but also be able to refer their clients to legal services. So I would say really common for like clients of caregivers, what they might be seeing is someone who is maybe facing eviction or some other form of housing instability. They might also see maybe the hours have been cut down randomly for their IHSS client, and it's not really clear why the hours changed. They might also see that been a benefit cessation. All of a sudden, the client can't afford the basic necessities that they used to be able to easily afford. They might also see possible signs of elder abuse or exploitation, and we can talk about some of those signs later. Just because of that intimate relationship that they have, and just seeing this person, on a regular basis, they might interpret that there's something else going on. And I think the most important thing to highlight is that caregivers don't need to be lawyers. They don't need to be legal experts in any way to recognize that something might be going on. The most important thing is for them to just have the knowledge of, I think something's going on, like, where do I go? Who do I go to? Who do I refer to? And I really think the best referral is going to be legal services. So civil legal aid, so this is everything that's not criminal. So public defenders are completely separate. Those are for people who are facing criminal issues. Civil legal aid is available throughout the country. Luckily, here in Los Angeles, we are truly blessed to have a plethora of legal services organizations, unlike a lot of places in the country where there are literally only one organization for an entire state. So just here in Los Angeles, there are many organizations that provide civil legal aid, and civil legal aid provides, free representation for low-income people, for eviction, for benefit cessation, bye Donna. um, for all kinds of things that are going on with people, elder abuse, domestic violence, divorce, child custody, etc. they are available and willing and able to help people with those problems, and also just because they are connected within the service area within Los Angeles, they also know about other programs that are available and other resources that are available for people. So I think the most important thing to take out of this for a caregiver is to know where to find legal services in your community. So I always like to recommend people go to the Elder Care Locator, which is it's a website that is facilitated by ACL, the Administration for Community Living, the federal agency. And it's, type in either your city or your zip code, and it's going to come up with all the, aging services that are available, but it will list the legal services that are available in your community. So here in Los Angeles, Beth Sedek Legal Services, which is in Koreatown, they specialize in older adults. They do a lot of work there. They've got some great IHSS experts there, and they, run a lot of clinics as well at the courthouse and at their offices virtually now with COVID. So that's just a great resource for people to know about. And I think it's also important to remember that just because you're not able to discern what the problem is or a specific solution, you are doing so much by just referring someone. I mean, that is incredible because most times people don't even know that someone is able to even parse out what's going on and try to figure out if there really is a problem, if something really did go wrong, or if everything, looks right and maybe they need help figuring out a new solution.
Great, thank you. And can you talk a little bit about what some of the, somebody brought up conservatorship, and we know that that's a heavy option. Can you talk a little bit about some other legal instruments and tools that we have?
Yeah, so there's, conservatorship or powers of attorney. These are all just names for different legal tools that are available to attorneys to help someone who is in a space where maybe they need assistance with either taking care of themselves, taking care of their finances. This is regardless of age. It's not, only older adults. People of all ages experience, needing help with these types of things. But, these are really very serious legal instruments. They involve, the question of personal autonomy. So I always like to tell people that, it's really important that you speak to an attorney about the options because, it's something that's very complicated. There are always the least restrictive means to accomplish the goals. And a really great legal services attorney is going to be able to actually parse out what are your actual goals, because most of the time, having another person have complete control over someone else's life really isn't actually going to solve whatever the issue is at hand. So, for example, if it's an issue of, someone is not paying certain bills on time because they just don't remember and they really need help with that. That might not be a conservatorship. That might be figuring out a trusted partner who can help out and figuring out some kind of legal instrument where they make those payments, or they get access to the account so that they can set up automatic payments, and then everything's good and we don't have to worry about the family member losing their caregiving again because they didn't pay for it, or possibly getting kicked out of a facility because it wasn't paid for on time. So I always like to just highlight that this is conservatorships and those types of legal instruments are a perfect example of why it's so important to be able to have someone be able to talk to an attorney with a family and really discern what's going on and figure out what is the least restrictive way to actually achieve what what the actual goals are. And also just knowing that these things are not permanent, they can always be adjusted, there's flexibility. So, that's just really the value of a legal services attorney, being able to give you that kind of peace of mind and give the client that peace of mind about, okay, these are actually what my options are, and figure out which one's actually best for you. I don't know if Elvira had any experience with those types of things with her mother. I'd love to hear that.
No, my mom had very little resources. We combined and paid private pay her care. But you raised a point that really hits home base, and that is whatever resources a person under a caregiver has. And I've seen this, and it breaks my heart. In our family too, they fight. They fight over, well, no, mom's bank account or credit card, I should handle it. And it's horrible, horrible fights. And the legal services, if everybody comes in together, if there is concurrence, because it is destructive to family relationships, believe me. And I've seen it over and over, but the family has to concur, because there's always going to be, well, this is what the conservatorship says, or the public guardian, but you can't run away from the family. So you were right on some of those instruments and how they can be safe and useful to mitigate those problems, I hope.
Yeah, and another thing that, is really important to remember is that when an attorney is representing, a client like that, their full obligation is to the client,
Yeah.
not to the family members that are around, the daughter, the son, the uncle, etc. So there really is that benefit of having one person, one party that really is there just for this person and their interests, and so they can take in all the information from everyone else around them, but in the end they are committed to protecting and upholding the autonomy and the wishes of that one person. And that's just a really important thing to note about when you're dealing with those types of issues, and also just highlighting the importance of an attorney.
Absolutely.
And you talked a little bit about some of the legal services that are available in Los Angeles. Do you have any others that you might want to just mention?
Yeah, so there's civil legal aid that is provided, it's throughout the county, and I want to highlight it is throughout the county. So there are legal aid organizations that reach to Palmdale, Lancaster, as well as, in Koreatown and South LA. They're all over the place. So that is actually one really good benefit of Los Angeles, and something that we should be proud of, that we actually do have access pretty widespread throughout the county. But access to legal services and be able to get to those offices is hard for people who have transportation issues, just because it might be really far. So if you go on the Elder Care Locator, they're going to show you legal services organizations that serve older adults, through also the Older Americans Act. So the Older Americans Act provides money for older adults to receive legal assistance. So different organizations receive money through the AAAs, the area agencies on aging. So the key is just calling and getting information. So that might be the caregiver, helping someone call, or someone just calling on their own and the caregiver's given them the information and going through that intake. Also, a lot of legal services organizations do have representation at local courts. I know that with COVID, people are not going into courts like they used to, but I'm hoping as the pandemic eventually ends, people will end up going back into the courthouses, and that is a place where people do receive help, because there are clinics and attorneys. Basically, a lot of those legal services attorneys, they're there because they know that's where people just kind of show up and with legal issues. So there are lots of people there, but I would say the Elder Care Locator is really a great resource to go to, and any legal services agency, if they can't cover whatever issue it is that you're calling about, they're going to refer you to whatever legal organization actually works on those issues. So some may only do only do housing law, or only do certain areas of law, but they're going to refer you to other organizations that do other types of law as well.
And for those, and we did put the Elder Care Locator in the chat so that folks have access to it. For the civil legal aid programs, is there an income requirement or a means test?
So it depends on the organization and like what their funding is. So, with Older Americans Act, no, but with other organizations, they may have specific income caps. But generally, what they will do is do an intake, and then they can assess what they actually can help you with, and what they can, if they can refer you to another organization.
Okay. And if you were above the income level, then would they give you referrals to someone in the private bar?
Yeah, so there's other options. They might give you referrals to the private bar. They might give you a referral to the State Bar of California. It just really depends. But I would say that no one should ever just be discouraged from calling because they think they make too much money. Let someone else make that determination. Call anyway, because even if you are, let's say you're over income, you still might be able to qualify for brief legal service advice from a clinic or some other organization that at least gives you information about, like, okay, where do I need to go from here? Do I need to actually hire an attorney, or is this something I could do on my own? And that information is really invaluable.
Mm, great. And would they also be the ones, sort of the hub of information for um, which courts will have the specialized clinics, like the restraining order clinics or the conservatorship proper clinics and those sort of things?
Yes, definitely, because a lot of them will be running those clinics. So that's going to be a really great resource as well, just to get the information about where you can go for a clinic.
So I had a couple questions in the chat, and thank you, Grace, for directing my attention there. So from Olga, any thoughts on how to reach more caregivers in the Latino community or other communities who do not see themselves as caregivers because it's family and they feel it's more of an obligation to care for mom and dad?
That's a real tough one. From my experience, what happened is we kind of all left the nest. So we were not close to my mother physically. So I knew a little bit about the field, and maybe that was helpful. But I go back to a little bit what Vivian was saying about education and clinics in appropriate communities and languages, that caregiving is overwhelming, and women especially lose wages, lose opportunities in their in the workplace, et cetera, and it really takes the joy out of family in a way. That's a real hard one. I just keep thinking about more education, more outreach, clinics like this, and really counseling, and not necessarily mental health counseling, because sometimes that carries a stigma in certain communities, but what is out there? What are your rights? And we're all in the same boat. So, a story coming from my family, it's another story from an urban family, because my mother was in a rural area. So that's a tough one. I struggle with that too. But I just can't help feeling that there are folks and services that can come together and create outreach and those kinds of strategies.
Yeah, I think it also speaks to what Donna had said about caregivers not self-identifying as caregivers, and that being kind of a universal issue, but then there may also be different ways of helping different communities try and identify, right, so that they have access to services, or we reframe the way we talk about caregiving for those communities, right? Also speaking to what Vivian had said about using our data to figure out, we create these wonderful programs that this slice of the population accesses, and what are we getting wrong because we're not having other people access those services, right? Is it as simple as having somebody who looks like you, like me, right, on that brochure, or is it more complex, and really trying to spend some time looking at that? So we have one more question in the chat. about, and I'm sorry, Phyllis, I didn't get to this question. It says, what advocacy strategies can you recommend to increase the state budget? Oh, this is loaded, Phyllis. To include more funds to address gaps in caregiving faced by African Americans and Latinx older, elderly, and disabled adults. Data shows that neighborhoods have been historically under-resourced in South Los Angeles and live more than 100% below the poverty line, specifically African Americans. There's a vast disparity in the quality and equity of caregiving services, and case managers currently fill those gaps. And then we have another question about how can solutions become innovative, collaborative, and culturally responsive to build capacity to reach more underserved demographics. I think we've been talking a little bit about that, and it segues nicely into our next question, which is about what advocacy opportunities exist for caregivers. I think that kind of speaks to Phyllis's point. And also, why is it important for caregivers to tell their stories? So kind of wanted to end on, I think there's so many opportunities in the state right now. There's a lot of resources being put into many different facets of our lives, including aging. And how do we get those dollars, right? We have to tell stories. We have to have our voices heard.
Yeah.
Yeah, I completely agree. I mean, I'm not an expert in policy, advocacy strategies. There's obviously lots of people who make a lot of money doing that. But I do think some of the most compelling things that I've heard during hearings for bills is when you have a personal experience that really speaks to what is, what you're trying to solve. And I really think it connects back to what Donna was saying, that so many people don't identify it as caregivers. So if people don't even identify as the group that you're trying to advocate for, then it makes it even harder because you've got an entire chunk of people that could benefit but aren't. So I think there really is work in terms of either getting people to identify as caregivers, regardless of if they're getting paid or they're just doing it because they believe it's something that they are supposed to do for their families, and then recognizing that role that they play in our community and really uplifting their role in the community, and showing that we appreciate caregivers. We recognize the fact that they are helping keep our communities together, helping people stay in our communities, and really getting their voices out there. I know that, we have to recognize it's a real time commitment to get involved in these types of budget issues and bills and things like that. But I think that, people reaching out to their elected officials when they hear about something and really just saying, hey, this is my experience. I want to, testify about it. I want people to understand that this would benefit me and people like me.
Yeah. Yes. Thank you for that.
I started my comments with saying something about that caregiving. It would probably be a major cost and a crisis in healthcare. As you well know, in 2010, ACA, also known as Obamacare, included the Class Act, which was a voluntary long-term care insurance program. It was repealed because of issues with its fiscal viability. But there's been some successes. Washington State already has something in the books, and Japan launched a mandatory long-term care for older persons back in the year 2000. So there are some models out there. Having said that, there are also some federal proposals that address issues of caregiving, like credits to families who give a care. And most recently, the governor signed, I think it was Monday, signed 2 bills that have to do with hospice and issues of reform in that field. But most importantly, there's going to be a state audit. One of these bills calls for a state audit. And I know it sounds bureaucratic and up here, but out of that state audit, some findings may come out that will propose legislation you know, and so those things create an opening for advocacy. There's hearings, and there's also committees that sometimes have local hearings on issues of concern. So, or we could start making requests. I think another opportunity for advocacy, and this is a hot button issue, but again, very, very close to my heart, is immigration and immigration reform. The majority of health aides, whether in facilities or in homes, in the field of caregiving, are immigrant women from around the world, okay? Women of color, or again, like the Assemblywoman Carrillo's story, where her mother was a licensed nurse in her country, but she couldn't practice here. And we have a lot of new Americans, that's what I like to call them, women who are probably in the same predicament, And so being able for those individuals who are skilled, who are talented, may need training and support in terms of healthcare systems. That's another avenue for advocacy. So it's a big table. It's a large table with a lot of things, but I like to think that there are some little some doors that we can open, or some windows that we could crack.
Yeah, that's you know, to quote Grace Yu, who said, "Caregiving is messy." Caregiving is messy, right? And there's so many facets of life that it impacts, right? I would say that when you were talking, Elvira, about, you know, the paid caregivers, I was thinking the paid caregivers need to get together with the family caregivers because they have mutual interests, right? And it is so important. And I think right now, where hearings in Sacramento are now being held over virtual platforms, so our, you know, family caregivers and our you know, paid caregivers have a hard time getting up to Sacramento, right, to have their voices heard. So right now is such a great time to engage, you know, both of these constituencies, because you can do it from, you know, with your loved one or your, you know, your client in the next room, and really have your voices heard. And I think one of the things I've done policy work and legislative advocacy, and have led some successful increases through the budget process for the long-term care ombudsman program in California. And one of the things that we had to do is we had to talk about our failings, and we had to bring forth things that were messy and didn't work out, and not usually what service providers like. We like to talk about all the great things we do. We need to talk about some really strong failures in order to highlight the need. And our clients, like family caregivers, don't have the ability to get to Sacramento. So I think this is such an important time for us to shift and make sure we're trying to engage caregivers and let them know that now, you know, you can be at the table, that one barrier is effectively gone. I'm wondering if anyone from the audience has any questions. I thank you both for a really, really great conversation, and wondering if anyone, we've been seeing a few questions in the chat. If any others have any questions, we have a few more minutes before the session ends.
Hi, thank you. I'm the director of the Personal Assistance Services Council, and we run the IHSS registry in Los Angeles County, and I really enjoyed everything I heard today. And I guess I have my first question is, you know, we talk a lot about collaboration. I'm wondering how this committee or this panel feels about the new Department on Aging and Disability that LA County is working on, and how do they see IHSS maybe fitting in that along with APSS and other organizations? And I think I'll leave it at that.
Great, thank you. Thank you, Greg. Any reaction from our panelists? Yes, Elvira.
Well, having worked at the city when it was the Mayor's Office on Aging, I'm dating myself, and the county AAA, I think we're still treating the older adult in segments, you know. Again, the collaboration, I like to think it's a holistic approach. It'll take time. I know there's the politics and the money, et cetera, but the collaboration is to make that holistic approach. You can't have, you know, in-home supportive services if they were together, where there is cross sharing of data, there is cross sharing of advocacy initiatives, even talking with staff. I do believe that would be of a benefit administrative wise, but more so to all the different communities and addressing some of the disparities in those particular communities because of poverty, language, or other issues. And it promotes that one door approach, you know, for services, again, effectiveness and efficiency. I like to, you know, I used to read bills. I certainly would like to talk to an APS person and an in-home supportive service administrator in the same place, in the same floor. And so I really think there are some positive steps and some good results, outcomes of an approach like that.
Yes.
Thank you. I noticed Dr. Benton just joined, and I wondered if she had a thought about the IHSS registry that serves 30% of the population that aren't family caregivers, and how they could be included maybe in the new department and involved more in these discussions. Thank you.
So if I'm understanding, the question is what to do with the registry?
I direct the registry, and we're advocating that IHSS and our registry be included in the new department that the county is developing, the Department on Aging and Disability, because we feel that the collaboration would increase the focus on people with disability and aging who use non-family caregivers.
Great. I mean, I certainly feel that any way that we can expand the availability of caregivers would be great. I think one caution or concern I would have when we do this merge is that the needs are different sometimes between the caregiving family and the disability community, so that it would be very important that the registry have people that are either cross-trained or in some very clear in who they can help. I think that that's generally a frustration that we've heard from our family members when we've referred them to registry, is that they're not always clear on if somebody's trained in dementia, if maybe are they trained to understand Parkinson's. And so for the disability community, they're going to also need specialized training. And I think that would be a great improvement for the registry, is the more information that we have. And of course, I think that means that from a policy standpoint, we need to pay people for that specialized training and have a reimbursement and incentives for both the companies that can help with the training, but for the workers, because they're doing this extra, I think that their reimbursement should reflect that extra knowledge and skill. So.
Thank you. And we're just at about 11:30, our closing time. And so I wanted to just see if any of the panelists had any final departing thoughts before we close out.
I just wanted to say I think this is just a great opportunity, and I think a lot of the issues that we discussed here today, you know, can be remedied by just people talking and sharing their experiences. So I think it's just really great that we're bringing these issues up, and thanks to Donna and all your expertise, and Elvira, all your personal experience is just so valuable for everyone to hear.
Thank you, Molly, for putting us together and giving us time to reflect our profession and throw in our personal experiences. Thank you all.
Again, I would want to reflect what Elvira said. Thank you for really having this conversation, and glad I could get back on for the end here.
Yes, that's great. I just really think it was a fabulous conversation. I was jotting down notes about ideas that were coming up through things that you all were saying. I just want to thank our panelists for participation this morning, and thank you to Rigo for the warm welcome, and Assemblywoman Wendy Carrillo for giving her opening thoughts to help kick this off. And thank you also to all the participants for being here for our first session and even staying all the way to the end. So thanks everybody very much.